how do we present ourselves to each other, but also to the community? And that's the Cook Children's Experience. It looks at, our mantra is to have the highest quality and the safest environment possible. That's our zero harm strategy that we present each and every time. That's just not a buzzword. That means that there's a lot of thought and a lot of processes to make sure that we have the right people, the right processes, and the right behaviors in place to not cause any harm anytime you entrust your child with our care. In addition to that, the second leg is the team experience, meaning that we got to take care of each other. We got to take care of our team if we're going to expect for them to operate at their best to take care of someone else. Then the third leg, and not in any particular order because they're all tethered, is the patient and family and member experience, meaning that we want to understand the needs of our folks who are calling on us for our services, and to make sure that we're operating and we're understanding the whole nature of that encounter, not just when they go to the emergency room, or not just when they go to a clinic, or when they get referred to imaging, but how does that tie in and how does that look in a holistic manner in delivering our very best to those patient families and members. As an organization, not as a medical center solely, or a home health organization or a physician network, but as an organization, Cook Children's Healthcare System, we're targeted, we're aligned in our communications, we are aligned in our strategies, we can be the most effective organization in the world, and we demonstrated that. Town Hall is a mechanism for us to connect with the entire organization. It's a way to set the tone in regards to how the organization is doing. It's a way to allow for our staff to feel like they're included. It's cultural with Cook Children's. We do our best, or we operate at our very best when we connect. Connection is key to morale, is key to operating in the right format, is key with feeling like I'm here for a bigger reason than myself. Our Cook Children's Experience was our defining strategy in regards to who we are. We rolled it out at the Town Hall meeting in 2019 with some fun. Our mantra is elevate every experience, and we chose the backset of climbing a mountain, and we likened it to trying to get to the top of Everest. It's not easy, but when you do it, you're second to none. I was inside a tent, and my character representing the patient and family experience was revealed later on in the session, and this tent was very small. And while I was in the tent, I was getting arm cramps, and my arm was going to sleep, and they told me not to say anything, and it was hot as wet in there. I work in administration, and we should have fun, no different than the doctor should have fun, no different than anybody who works in our organization. But we're serious about our commitment to each other, and we're serious about our commitment to patients. I'm excited because there are so many people who have been saying, where are we, what's next? We're going out into prosper, new, uncharted territory. We're international. We're doing a lot of things in West Texas. And how do we show each other our commitment? Our promise is so amazing, and it talks about every child. Our promise is so amazing that it doesn't leave anybody out. So as a result of that, that's why you come to Cook Children's, right? You don't come to Cook Children's because you say, well, I'll show up some of the time, because our patients need us all of the time. We need each other all of the time. So I'm excited because this town hall meeting says we hear you. You've got folks that are in the trenches every day that you don't see or hear about, but they're delivering. They're delivering on this Cook Children's Experience as we speak, right? Any great organization needs alignment. Why are we here? Why is the task that I'm performing necessary for the mission of the organization to be effective? That's the Cook Children's Experience. Alignment, celebration, course correction, but with our goal being that we are the preeminent place to work and the preeminent place to receive care, second to none. Not that we're in the conversation, we're leading the conversation.